And Ms. Jaya Sitaraman, and I used to take tuitions, and then I worked for some time in the office also. And little sugar I had. I didn't have any sort of any disease or anything. I was perfectly alright. And suddenly, at the age of 85, I didn't have sleep at night time. My breath, I had a trouble in breathing. So it was only little. So I didn't care for that. But I didn't thought of heart. I thought it is due to lungs breathing trouble is there. But suddenly one day I couldn't, probably I couldn't make any work or anything. I couldn't do anything.
She had a very sporadic cases of breathlessness. Initially, we all thought that because of the COVID situation around, we thought that maybe she has some infection in the lungs. But when things didn't improve, I referred to Dr. Ganesh at LH Hirandanani Hospital in Powai.
Mrs. Jaya Sitaraman approached me the first week of November 2020 during the peak of COVID pandemic. Our son, in fact, took an online appointment from me saying that our mother is having a lot of breathlessness even at small activity. And what she started complaining is she was not able to do these daily chores she was actually doing before. And gradually what happened is she was not able to do her own daily activities. This was rapidly followed in the next 15 days by presenting with what is called as orthopnea in medical language. This orthopnea means the moment you lie down flat on the bed, you start feeling breathless. She landed up straight away by ambulance. Her son got her to my outpatient department and she was very breathless. Immediately on evaluation, we found her to be in florid heart failure, and an echo showed that her heart pumping, what is called as LV ejection fraction, had dropped down to 15 to 20%, and she had severe aortic stenosis. Aortic stenosis patients, when they present with such a bad decompensated heart failure, with heart functioning falling down to as low as 20%, it actually becomes a high risk of sudden death. But now with the transcatheter aortic valve replacement, which is also called as TAVR, there is a big hope for this category of patients, and that is what we thought that we should offer her this treatment as soon as possible. As you know, TAVR, which is a transcatheter aortic valve replacement, is a non-surgical valve replacement, wherein patient is wheeled into a cath lab. The equipment that you see behind me is a cath lab table with monitors in front of it. This is a place where we do a routine angiograms and an angioplasties. So similarly, from the groin approach, the femoral artery, we puncture the groin, and from through that we take in the device, which is an aortic valve over a wire. Before actually implanting the valve, we do a ballooning of the valve and make space so that the valve can actually be smoothly placed across the diseased aortic valve. And when we expand the balloon, as you will be seeing in the cine pictures, the valve nicely sits over the previously diseased valve, which is crushed by the balloon which we had done prior to the valve implantation. From skin to skin, we could finish this case in 40 minutes with no untoward event or complication. Her ejection fraction, which was as low as 15 to 20%, that is the pumping of the heart, within first 24 hours picked up beyond 35%. So that was an excellent news to us.
One of the primary worries for me was, will my mother go back to being leading that active life? And I can happily say that thanks to TAVR, my mother is back to doing what she was doing prior to the detection of aortic stenosis. So she's waking up in the morning, she makes breakfast, she does her regular job.
And now I am perfectly alright. I am feeling. I am now working in the kitchen. I am doing all the job. and I am getting down, and the staircase I am 3 floors. I am getting down and I am climbing 3 staircase, and no trouble. I am not feeling any trouble. I am not